I'm Dr. Gina Dillig, and I work in Glenview, Illinois at the Skin Care Center.
My name is Dr. Amy Taub, and I am the founder and medical director of Advanced Dermatology in Lincolnshire and Glencoe.
I tell patients to look at their skin at all times, and basically you're looking for a mole that looks different than all the other moles. You know, we sort of use this rule as the ugly duckling rule.
Something that's growing, bleeding, scabbing, like a mole that has irregular colors, or the border is irregular, or it's not symmetric. If it's in the family, if you've had a lot of sunburns, the more fair red hair you are and a lot of freckles, if you have a lot of moles, and if something clearly looks abnormal to you.
A is asymmetry. You're going to see a mole that is not round and regular, okay? B, border. The border kind of, again, looks irregular or starts growing past or beyond what is a normal circle. Color. This is a really important one. Generally, melanomas are dark or have multiple shades of brown or sometimes even blue in them. And that's a huge red flag. Those definitely need to be biopsied. And then diameter. That is anything larger than 6 millimeters. That is the size of a pencil eraser. The worst thing about melanoma is that they're very unpredictable based on what stage you catch them on. So depending upon how deep the melanoma goes into the skin, that's how likely you are to have spread from your original lesion. And it can spread anywhere. It can spread through the lymphatics, it can spread through the bloodstream. So in that way, if you catch an early melanoma, it's not going to be as detrimental to your health. If you catch a late melanoma, meaning it's deep, it's spread deeper into the skin, that's where you can have trouble.
Because they say now that 1 in every 11 people could develop a melanoma over their lifetime.
One of the most common contributions is sunburning the skin. UVA exposure can be another big one. Damage happens in the top layer of skin in these pigmented lesions, because majority of melanomas are pigmented, meaning brown, some degree of brown. You can have an amelanotic melanoma with no pigmentation, but it's rare. So the damage starts on the surface, and then the melanoma starts on the surface of the skin and usually spreads down most commonly.
So the thinner it is, the better.
If you have a deep melanoma, generally it's greater than 1 millimeter in depth from the surface of the skin down deep underneath the skin, you have to have a larger procedure done.
That will tell you, like, has the tumor already spread into the lymph node? If it has, then you're a stage 3 and you would be eligible to have chemotherapy.
If the melanoma has spread into the lymph nodes, there are other potential options for treatment. You can do some chemotherapies, and there are some new immunotherapy or directed drugs that are better at treating the melanoma.
Immunotherapy that uses your own immune system to fight off the cancer, and they're much less toxic because they're not killing all the cells. So they can actually test the tissue itself and see, like, the genetic inscription of the tumor. There's different types of melanoma. So the most common is called superficial spreading. So let's say you have a mole and it's flat. A lot of times melanomas are flat. That's another thing people don't realize. It's flat, and then it may grow what we call radially. Like the mole looks like it's getting bigger and bigger over a long period of time, sometimes even 10 or 15 years ago. Then all of a sudden something happens, we don't really understand that part, where it can start to grow vertically. That's when it becomes dangerous. Is when it starts to grow vertically, that means that the cells could go into the blood vessels, which are underneath the surface of the skin, and then that could take them to lymph nodes or other organs, and that's when it becomes dangerous. There's another kind of melanoma called nodular melanoma, which just grew out of nowhere, and like somebody really noticed it because it's like, oh, I have this bump on my skin and it wasn't there before, and it's obviously grown. Those are very dangerous because those start almost immediately with the vertical growth phase, and for some reason the cells are more aggressive, so they just have a biological capacity to spread more.
And age isn't such a factor, although it's rare in younger patients to see a very deep melanoma, but the treatment's completely dictated by the depth of your melanoma. So if it's superficial, it's rather straightforward. If it ends up being deeper or more, it's evolved longer, it's been around longer, it's had more time to spread.
The older you are for melanoma, the less likely it is to spread. If you're over 55, there's less chance of it spreading, and if you're over 65, there's even less chance. So that's a good prognostic factor. In terms of like the long-term prognosis, I don't think it really affects it very much.
Yes, I'll see deeper, more advanced melanoma in people that are mostly over the age of 40.
If you have a melanoma and you have it excised, meaning surgically removed, and your lymph node was negative and it was a fairly thin melanoma, there's a 95% chance or better that you will survive and it will have no effect on your lifespan. Once the initial period is over, if you don't need chemotherapy, basically don't need treatment except for screening.
It can be, a couple of weeks, okay? But it's not over then, because these patients who have melanoma can get melanoma throughout their life. So generally, if you've had a melanoma, I have my patients come back every 3 months, usually for about 2 years. At the 2-year mark, if I haven't found anything else that's suspicious, then I will have them come every 6 months for up to 5 years. Once you're 5 years past your melanoma and nothing else has been found, if it's a deeper melanoma, the treatment's much more involved and can be lengthy. And it can be months of chemotherapy and other treatments that you have to do. And then it's continual scans, because even when it looks like the melanoma is gone, it can come back years later. Prevention of melanoma is very simple. Sunscreen, avoiding sunburns, coming to your dermatologist. Because there is a genetic familial component to the melanoma. And so it's important, even if you don't burn your skin or you're never in the sun, if you have a family history of melanoma, you have to see a dermatologist.
Be as protective as you can. Number one, don't go looking for a tan. Don't lay out in the sun. It's kind of hard to completely stay out of the sun. Plus, the sun kind of makes us feel good, so that's another kind of a little problem because we like to be outside.
Never going to tanning beds. Tanning beds are specifically dangerous, and people who go to tanning beds are exposed to UVA and more likely to get melanomas. And it's been shown that if you go to tanning beds, you're more likely to get melanomas at earlier ages, under the age of 30. It's terrible for your skin and puts you at risk for melanoma, and you can die.
And then be careful when you're on a vacation, because a lot of times, like for instance Chicago, it's nice in the summer, but most of the time there's not very much sun. But then we go away to Mexico or Jamaica or Florida or whatever we do, and we're like, yay! This spiking of sun exposure, like here's a big spike, and then there's nothing, and then there's a big spike, that is actually not good for melanoma. Just try to be moderate about sun exposure. Use sunscreen and try to seek out the shade when you don't have to be in the sun.
Because it's one of the deadly skin cancers. If it does spread to your liver or your brain or other areas of your body, it's untreatable at that point. And so, since you can die from it, and it's something you can see on the surface of your skin, it really makes sense to try to avoid it. Do you have a family history? Do you have multiple moles larger than a pencil eraser all over your body? If you do, then you need to see somebody sooner rather than later.